You are about to discover the Hydradermie Lift Eye Treatment. This specific treatment, performed in 35 minutes, treats the entire eye area. It achieves visible results, boosting a youthful appearance, reducing shadows, and regenerating tired eyes. This treatment also uses the anti-wrinkle eye serum gel, which penetrates deeply with its double ionization action. The ball electrodes follow specific movements on the contour of the eyes, providing complete drainage, and then stimulate the skin for a visible lifting effect. In preparation for treatment, the beauty therapist consults with the client to determine her beauty goals. This consultation aims to define these beauty goals and to select the appropriate serum gels. Carry out makeup removal on the eyes and then on the lips with the eye makeup remover. Then apply the cleanser appropriate to the skin type of your client, to the face and neck. Rinse. Tone. And blot dry with a tissue. Apply the anti-wrinkle eye serum gel to the contour of the eye, crow's foot, avoiding the lashes all the while. Select the ball electrodes button. Set to level 2 for drainage. Set the timer to 10 minutes. In order to perform complete drainage and eliminate the toxins, carry out the movements in the following order. For the first path, from the eyebrow to the jaw, one ball electrode remains fixed at the beginning of the eyebrow, the other moves over the forehead, to the temple, and then down to the jaw. Second path, from the inner corner of the eye to the temple, one electrode remains fixed by the sinus bone, the other moves along the contour bone under the eye to the temple. Third path, from the temple to the jaw. One electrode is positioned on the temple, the other moves down to the jawbone. Repeat each movement 4 times, slowly, on one eye, then on the other. For muscular stimulation, start by selecting level 5 and checking that the muscle contracts when the electrodes are moved, without the client experiencing any sensation of discomfort. Increase the timer to 10 minutes. Perform the movements in the following order. First movement, orbicular muscles of the eye. Firstly, an electrode remains fixed on the outer corner of the eye. The other moves along the contour bone under the eye to the inner corner of the eye, then returns to the temple with a back and forth movement. Then electrode remains fixed on the outer corner of the eye. The other moves along the brow bone with a back and forth movement. Second movement, orbicular muscles of the eyes. Firstly, an electrode remains fixed on the temple. The other moves along the contour bone under the eye to the inner corner of the eye and back, performing a circular movement. An electrode then remains fixed on the outer corner of the eye. The other moves along the brow bone with a back and forth movement. Third movement, frontal muscles. On the first path, one ball electrode remains fixed on the brow bone, the other moves up to the forehead. Repeat this movement for the second and third paths approximately 1 centimeter apart. For the fourth path, place the 2 electrodes on the lower eyelid, a half a centimeter from the outer corner of the eye. Move an electrode from the outside corner of the eye to the temple in a diagonal line. Repeat each movement 4 times, slowly, on one eye, then on the other. Remove excess serum gel with a spatula. Rinse. Tone. and blot dry with a tissue. Apply the eye lifting serum and massage until it penetrates to the contour of the eyes. Apply the modeling cream serum to the whole face and neck and eyelids. Perform a massage to the contour of the eyes. Apply the eye mask. And allow to rest for 5 minutes. Rinse. Tone. Then blot dry with a tissue. Complete the treatment by applying the treatment cream appropriate to the beauty objectives of your client, to her eyes, neck and face. The results of the Hydradermie Lift eye treatment are visible immediately and are even more lasting if performed on a regular basis. So that your client can assess the full effectiveness for herself, suggest she does the mirror test. She'll see that tiredness is removed from the face, lines and wrinkles are smoothed away. Arrange an appointment with the client for her next treatment and prescribe the home care products necessary between treatments. Carry out a flash beauty treatment using the Masters Colors professional makeup products. You have just discovered the Hydradermie Lift eye treatment. Hydradermie Lift is a lifting treatment that rivals surgery. It rejuvenates facial features like a lifting treatment by stimulating the muscles in depth. During the 1-hour treatment, the beauty therapist performs the equivalent of a bodybuilding session on facial muscles, especially for those normally less used, which with age or tiredness can lose their tone. The ball electrodes are firstly used during a drainage phase to eliminate toxins, and then a further phase of muscular stimulation to increase the firmness and volume of muscles for a lifting effect. In preparation for treatment, the beauty therapist consults with the client to determine her beauty goals. This consultation aims to define these beauty goals and to select the appropriate serum gels. Remove makeup from the eyes and lips using eye makeup remover. Next, apply the cleanser suited to your client's skin type. Rinse and blot dry with a tissue. Apply the exfoliating cleanser with the fingertips, using circular movements to the whole face, neck and décolleté, avoiding the contour of the eyes. Its cleansing action will dissolve traces of makeup and its exfoliating action will superficially eliminate dead skin cells through enzymes. Rinse, tone, then blot dry with a tissue. Apply the serum gel Age Logic or anti-wrinkle serum gel onto the entire face, neck and contours of the eyes in a thick layer. Select the ball electrodes button, adjust to level 2 for drainage and take up the 2 ball electrodes. Set the timer to 10 minutes. The movements are applied from the top to bottom of the face to drain toxins and improve the blood and lymphatic circulation for a period of 5 minutes on each half of the face. First movement, the forehead. One of the ball electrodes remains fixed in a position above the beginning of the eyebrow, while the other ball electrode moves over the forehead to the temple. Repeat this movement on path 2, then on path 3, continuing the line down to the base of the neck. Second movement, the contour of the eyes. One ball electrode remains fixed by the sinus bone, while the other ball electrode moves along the contour bone under the eye to the temple. Then place one electrode on the temple, while the other electrode moves down to the jawbone. Third movement, laughter lines. One ball electrode remains fixed 1 centimeter from the nostrils, the other electrode moves along the laughter line to the jaw. Fourth movement, the neck. One ball electrode remains fixed on the neck, in line with the corner of the mouth. The other moves down the neck to the clavicle. Repeat this movement on paths 2 and 3 at approximately 1 centimeter intervals. Repeat all these movements on the other half of the face. For muscular stimulation, the movements are carried out from the neck, moving up to the forehead on one half of the face, then repeated to the other half of the face. Each movement needs to be carried out 3 times. Before beginning the stimulation phase, adjust the intensity according to the client's sensitivity, starting at level 5. Arrange the 2 ball electrodes one under each other and move one of the electrodes downwards to observe the contraction. Do this once again, increasing the intensity until a contraction is achieved, without the client experiencing any sensation of discomfort. With the intensity now set at an optimal level, adjust the timer to 10 minutes and start the stimulation phase. First movement, mastoids. One ball electrode stays fixed under the ear, while the other electrode moves down the neck to the clavicle bone. Repeat this movement on paths 2 and 3 at 1 centimeter intervals. Second movement, the masseter muscles. One ball electrode remains fixed on the jawbone, the other moves up along the masseter muscles, stopping in line with the cheekbone. Repeat this movement on paths 2 and 3. Third movement, zygomatics. One ball electrode remains fixed on the corner of the mouth, the other moves over the zygomatic major. Repeat this movement over path 2 for the zygomatic minor, moving the 2 electrodes up by approximately 1 centimeter. Fourth movement, the orbicular of the eyes. One ball electrode remains fixed at the corner of the eye, the other moves along the contour bone under the eye to the inner corner of the eye in a back and forth movement. On path 2, one electrode remains fixed on the temple, the other moves along the eyebrow in a back and forth movement. Fifth movement, the frontal muscles. One ball electrode remains fixed on the brow bone, the other moves up to the forehead. Repeat this movement on paths 2 and 3 at 1 centimeter intervals. Repeat all these movements 3 times to the other half of the face. Remove the excess serum gel with a spatula. Then rinse, tone, and blot dry with a tissue. For a more specific Hydradermie lift, apply the eye lifting serum to the contour of the eyes and lips and the long life neck serum to the neck and décolleté before the massage. Apply the modeling serum cream, which is rich in active regenerative and firming ingredients and gives smoothing results. Perform the massage for 10 minutes to drain the toxins, nourish the skin and remove tiredness from facial features. Apply the eye mask to the eye contour. Then apply the Energy Lift Mask to the face, neck and décolleté. Allow to rest for 10 minutes. Remove excess mask using a spatula. Rinse, tone and blot dry with the tissue. Complete the treatment by applying the treatment cream appropriate for your client's beauty objectives to the eyes, neck and face. The results of the Hydradermie lift treatment are immediately visible and even more lasting if performed on a regular basis. So that your client can assess the full effectiveness for herself, suggest she looks at her face in a mirror. She will observe that her face looks several years younger. The face is rejuvenated, tiredness is removed from the features, lines and wrinkles are smoothed away, the skin is more supple and firmer. Make an appointment with the client for the next treatment and prescribe for her the home care products required between treatments. Do a quick beauty touch-up with Masters Colours professional makeup products. You've just discovered the Hydradermie lift treatment.